Little history lesson for you. Did you know the Praetorian guards were the elite bodyguards of the Roman emperor and their families? Well, the same goes with Praetorian Health Services. They take a lot of pride in the services they provide for their families. And Jessica LaHaye, how are you?
Doing
Good to
great.
see you.
Good to see you.
She is the CEO here at Praetorian. And if you would, I mean, we've talked to you before, but
Right.
I want to let our viewers know. Give us a little background, if you would, about the about Praetorian, how it got started.
Okay, well, Praetorian Health Services is a in-home private duty non-medical service. We provide services for Medicaid waiver recipients who are on the elderly and disabled waiver program, which receive personal care services and in-home respite services. We also assist with the VA, home health aid, and homemaker services and respite services. And we have just become providers for the IDD waiver services, which are intellectual development and developmentally delayed individuals who get to stay home and integrate themselves back into the community for home and community-based services and nursing respite. And we also do private pay. So what we try to do is implement the different pay sources, find out where families fall as far as what services that they could qualify for, so they don't have to pay out of pocket before we do the private duty aspect of reimbursement.
Now, as far as health services that you provide, you do on different levels of some of the things. Talk a little bit about that. I mean, companion services, full health or whatever.
Right. Well, we do. We offer companions who are basically individuals who come in and assist with light housekeeping, laundry, running errands, transportation to and from doctor's appointments. To the next level would be a certified nursing assistant. That's someone who has a little more medical background who would assist with utilizing DME equipment in the home, like a Hoyer lift, ambulation, transfers, things like that, bed baths. All the way down to assisting with emptying catheters, assistance with changing a colostomy bag, things like that they would need a little more skill level. Instead of staying at home, they would have to be in a nursing facility to receive those services. So we offer that. And then we offer LPNs and RNs who can come out and assist with trach care and as well as
pretty much anything the nurses do.
Well, yes, tube feedings, things like that.
Yeah.
Medication reminders, assisting with keeping them on their medication regimen so that they can stay home and live life to their fullest.
Now, is this all geared towards elderly?
No, it's not. We take care of individuals who are
Go through rehab or something like that at home. So maybe they've had surgeries or something like that they need that extra help with and until they get back on their feet themselves.
Right, absolutely. And once we get them there, it's a very flexible scheduling system. They don't have to use us 24 hours a day, 7 days a week, although we're available for that. We can come in 3 hours once a week just to help you maintain and keep your independence, help you with range of motion exercises, help you get stronger, and just offer support where you need it.
Well, a lot of times you find that the caregivers themselves are members of the family.
Right.
And excuse me, they may be younger members that they have full-time jobs. They have families of their own.
Absolutely.
And not to take anything away from trying to help mom or dad or whatever, or a spouse. And that's where Praetorian comes in, because you give them the opportunity that they can get out and do the things that they need to do.
Right.
And you can step in and help where needed.
Absolutely. Our caregivers, we customize our care plans based on each individual's home service need and what that family needs. So it's not just a care plan for the individual, it's also a care plan for the family. Taking care of the people who are taking care of the individual who needs the help, and that's almost a given as well. I mean, you've got to take care of yourself so you can take care of someone else. Like they tell you on the airplane, put the oxygen mask on yourself first before you help someone else.
Right.
It's the same. If you aren't taking care of your well-being, you can't take care of someone else. So we can offer that support and assistance to help people just have a break, just be able to walk away, get 10 minutes, go get a coffee or go read a book for a little while and just recharge and come back and be able to continue to be able to provide those services.
And that's a great thing, because like you said, it's not something that you have to be there all the time.
Right, right. And some people this is there all the time. That they don't have a break, they don't have a support system. So we want to try to be able to help them have the dignity and the respect and the independence that they can have for as long as they can have that. Especially when our seniors have worked so hard for the legacy that they have to leave, and now they're at a very critical point where do I decide to go to a nursing home, or do I decide to go to an assisted living facility?
And a lot of them feel a lot better being in their own homes.
Right, right. It's the most therapeutic place for us, is to be at home in a sanctuary, in our place of peace. And we just, there's a lot of documented evidence that shows that being at home helps us to heal and restore and get better.
Let's talk about some of the training that you do here at Praetorian. You have basically a school, training center here.
Well, we really like for our caregivers to go out prepared. We have a registered nurse, Carrie Flowers, on staff who does our personal care training, and she is fabulous. She takes our caregivers all the way through helping transfer with a gait belt, all the way to a full bed bath in the bed, changing an occupied bed, helping with Hoyer lift transfers, stand-up lift transfers, making sure that that our caregivers have the sound body mechanics to assist these individuals with that service before they go out. Because if I have a client who calls and says, I need someone to help me with these things, and I have a caregiver who hasn't exhibited those things to us that they can do that properly, then it's just not a very good fit, and it's not going to be conducive for the client. So we want to make sure on the front end that we do everything we can to invest in our employees.
Now, does somebody, if they want to come here and work for you, do they have to be a registered nurse or something? I'm sure it helps, but do they have to have a background in nursing?
No, they do not. They can be what we call a homemaker or a caregiver, which is just, like I said, our basic sitter services that we offer, which are assisting with people who are still able to do things on their own. They're still, they may just have Alzheimer's or dementia and just need a little redirection and a little oversight. A little assisting with meal preparation, helping with medication reminders, things like that. So we can train them, but we do like for them to come in with CNA certifications, medical assistant degrees. We certainly prefer those, but of course we do have our registered nurse who can assist with the personal care training.
Well, if you'd like some more information about it, I guess they can call the number on your screen. You're located here in D'Iberville.
Yes, sir.
It's real easy to get to, but if you'd like some more information, 314-1290 is the number. You can go to their website and find some great things too. And your new facility is really nice.
Thank you.
It's really, really nice.
We're very excited to be able to offer Alzheimer's caregiver support group once a month on the first Wednesday. So we're able to give more back to the community.
Thank you so much,
Thank
Jessica.
you.
If you want some help, give them a call. It's Praetorian Health Services.